recent tools that you've implemented to help bring, and as Dr. Nightingale said, that continuing resolution to support telehealth?
So the two obvious ones, one of them is telemedicine. Our great partners at eVisit have really allowed us to understand what that area looks like and to push forward on it and really expand what our access is and to make it easy for our patients and our providers to be able to access it. That's key. It has to be easy in order for it to be successful. And not to sound like a commercial for eVisit, but they do a really good job of doing that for us. The other part of that we've been able to do and be very successful with is an ambient technology. So for ambient scribe, for those guys that aren't sure what that is, it's an artificial intelligence system that essentially listens to the conversation between the provider and the patient. And that has really changed the relationship with the provider and the patient. And Dr. Nightingale can probably speak better to this than I can because she's a practicing provider. But as a patient, I've experienced it, and it's very nice to be able to talk to your provider as to talk to the side of their head while they're working on their computer. Every EMR requires the providers put a ton of information into there, and there's so much that they have to capture during that appointment and then afterwards. That afterwards is what adds to the provider burden, and the pajama time that they call it, and the time away from their family, whatever, whether it's early in the morning or late at night. Ambient scribes are taking that burden off the providers, allowing the patient and the provider to really connect in a way they haven't been able to connect in ages, and then decreasing some of that burden, giving them a little bit of their life back. We've gotten lots of comments and very pleasant comments and around how this has changed the way that the providers are able to practice, and it feels like they have that back. Those that have kind of knew what it looked like beforehand, that have been in the field a long time, and then those that are new, they're like, this is why I got into medicine. And so it's really good to hear that. And there are a lot of other ambient tools that are out there that I'm actually looking into that are going to help us to be able to close care gaps and make sure that the patient's needs are met for our chronic care populations, to be able to close those care gaps down even more and help provide better care and access to the patients.
I know another item that we're excited that you guys are going to be implementing is now during your virtual visits, having an integrated interpreter tool now is going to be something that's really going to help you,
Yes.
especially being in Oklahoma and then, as to your point, in these rural communities. So we're excited to help implement that.
Excited to have that. We have a good virtual language partner, and we are now working with them and with eVisit to get that integrated in. It'll allow us to couple things. One, the provider will have a virtual interpreter in up to 40 languages available within moments to be able to do that within the virtual session. And we have not had that beforehand. It also frees up our medical assistants who may be Spanish bilingual. Right now, they're involved in those telemedicine sessions, preventing them from doing the work that they need to do as medical assistants. They're playing interpreter, and they have a lot of valuable work that needs to be done. They can be rooming another patient. They can do so many things. And so it's going to free up that workflow and hopefully allow patients to be seen quicker in person and in the telemedicine areas. So very excited to have that integration built in.